Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this story episode, we are going a little non-traditional.
I was going to say that.
Ooh, we're on the same wavelength tonight.
So yes, we are talking about emerging settings in athletic training as defined by the NATA as physician practice, armed forces, performing arts, industrial, healthcare admin, rehab, and public safety.
You know what I liked about the story topic is it really kind of highlights National Athletic Training Month's motto about healthcare everywhere, providing healthcare everywhere.
Yes, and we're not forgetting about our traditional setting because we're going to do that upcoming in another story episode.
Of course.
But what I think we actually got stories from each of those. We got physician practice. This is the order we're going to go in. Physician practice, military, performing arts, industrial. We didn't get any public safety, but we did get healthcare admin, rehab, and also business owner and a PT clinic.
And I feel like public safety is like one of the newer ones. Like it's still trying, I feel like, to get up there.
Which I feel like we've gotten stories about public safety before. We just haven't we didn't get them specifically for this episode.
Yeah.
So like it's out there.
It is, definitely.
I think we only got a few performing arts stories, but I work in performing arts well, I guess now it's not part-time. It's per diem.
Essentially, but you still have a good amount of experience with the performing
arts. So like I literally almost put that in its own, I mean, it will be its own episode one day. But here's a little taste. Right. A little bit of background for you guys. It's kind of funny because I feel like Randy and I cover a lot of settings between the two of us.
Yeah, that's true.
Because Randy's done D1, NAIA, collegiate sports.
Yeah.
As well as elite, like USA sports.
Like professional.
Professional. I've done performing arts. I used to work basically full-time hours with performing arts, and then with like a lot of different performing arts.
You've had a variety,
right? Band, dancers, actors, singers, stage techs.
Yeah, like occupational stuff.
Occupational, right? Like people behind the scenes, costumers who have never ever worked out before. So like that's really broad. And then also like professional dancers in a dance company. And then I work full-time at a community college. So like between the two of us, and I also used to work youth sports. So I feel like between the two of us.
You are well-traveled.
Yeah.
Very well-traveled.
But neither of us have done armed forces.
Yeah.
Physician practice.
Yep.
Industrial kind of.
Yeah.
Or public safety.
We haven't been a business owner.
Right. So we're turning to you guys. So why don't we start with our first? I put physician practice first, and we have a couple stories of those. So why don't you read the first one?
Yes, let's do it. So this one's by Jessica J. I work at our local hospital with our orthopedic surgeon. I have my own clinic schedule made up of usually fractures, post-ops, and any of my athletes that need to come in. Anytime someone comes through the emergency department with a fracture that needs to be reduced, he gets a call, and if I'm there, he'll ask me if I want to help or do it. That's pretty cool.
I know.
It's awesome. I've learned so much through that. He'll let me assist in surgeries too, although I need to get my OTC certification so I can help with the bigger stuff. And then, of course, the hospital pays for me to go out to the high school.
Which I feel like is a good balance.
Of course. And
you can
also
get to like some traditional, some non-traditional.
Again, and it's just so cool. You get to help with surgeries.
Also, I feel like working like right with a physician, you get to learn so much.
The people that I've known that have worked in like a physician's practice or, a surgical group have all loved it and have all felt like they learned so much. And that's really cool. And
even what she was talking about with anything that needs to be fractures that need to be reduced. Wow. I was thinking, I heard reduce and I was thinking dislocations.
Yeah.
Which when I was thinking dislocation reduction, it's like if they're making it all the way to the doctor's office, that's
That
got
bad boy's probably out for a while.
right, which usually means it's harder to get back in. So you get all the cool techniques.
See, like, if there were more hours in the day, I feel like I would like to experience the physician practice.
Right.
Like, after my traditional job, go into the physician practice for a little bit.
Right. Well, I mean, they have those, like we were talking to Allison.
Yeah.
Our way back, one of our first episodes.
I know, but I can't believe how long ago that was.
About residencies.
Yeah, that's true.
Yeah. Actually, it's really cool because, actually, I think our next story talks about, like, working within the healthcare team a little bit.
Nice.
So this is from Becca W. She said, I work in the Department of Orthotics and Prosthetics. I am one of 6 ATCs in the department, and we are assigned to different hospitals in the system. Mine is mainly ortho surgeries, so tons of shoulders and knees. My coworker has spine and brain surgeries, and we have coworkers who do mostly pediatrics. I would say knee braces are my favorite, but the post-brain surgery helmets are pretty cool too. As an ATC, we sat for our CFO, which is Certified Fitter of Orthotics exam.
Oh, nice.
And we fit all of the shelf orthotic devices, knee braces, slings, etc. And we work with orthotics and prosthetists. They do all the custom orthotics and prosthetics. My work paid for the exam and the classes for the CFO. I specifically work inpatient, so I fit patients with braces and educate them on their new device post-surgically while they're staying in the hospital. Since I work inpatient, I work very close with surgeons, their residents, PAs, PTs, OTs, and nurses to provide the patient with the exact brace they need, which may require making some minor modifications to the brace in order to allow it to fit properly. We do evaluation still, in a way, in the outpatient setting because we get a referral from a doctor with a general type of brace, then we eval and measure for a more specific fitting brace during the appointment. Also, hours-wise, I work 8 to 5, Monday through Friday, and have all holidays off. Our residents work on call weekends and holidays.
So what you're saying is, first of all, most ATs' ears perked up
Right.
when they heard the Monday through Friday and holidays off.
And 8 to 5.
And 8 to 5. So I'm glad you read that one because I feel like I would have prosthetists.
Okay, so
that one would have got me.
So I practiced that one because for one of my lecture classes that I teach, I was teaching about the different healthcare careers, and that was one of them. And I was like, oh shoot, I have to record myself saying this.
Yeah, that's a good one right there.
So I feel like I need Becca to come into my work and tell me what all of our braces do because we have right now, I just got this job recently, like late last year, and both my co-head and I, we actually both started at the same time, and we are reorganizing the ATR right now, and there are so many braces that we know and that we've seen before, that we've used before. But then there's a lot of like shoulder ones and
interesting.
And like I think knee, like it looks like it would fit a knee.
Okay.
That we're just like, I don't really know what this is for or when we would use it. And so it's like I want to put it to good use.
Of course.
So, I mean, maybe they were just donated. They look a little bit old.
Oh, then probably. I'd say so.
Right.
Like maybe an athlete from surgery or like from like your physician that you work with.
Right. So, I mean, this would be very useful.
Hey, you did get some supplies from your physician though.
Yeah. Well, also part of those things, it's like, okay, what am I going to do?
What am I looking at here?
Right. We actually got a lot of soft cervical collars.
Oh, that's nice. I had to order some.
What do you use them for?
Neck pain.
You send people home with a soft cervical collar?
Yeah. Not very often, but yeah. if it's really bothering them enough, yeah. And I've actually gotten some pretty good success. There was one time.
Wait, your athletes actually wear these?
Okay, so that's where I'm getting into. So I had a cross country runner with torticollis, and it was really acting up for this one weekend. And I think it was cross country regionals that we were going to. So like, and she was our best runner. So it's kind of like, we need her to feel good.
Uh-huh. And
I looked at her and said, hey, now don't don't shoot this down right away, okay? It's going to look stupid and you're going to look a little weird, but it actually might really help you. And she's like, all right. So I went to the back of the storage. We had one soft collar. We
have like 10.
And I brought it out and I said, I want you wearing this like when we're on the plane and stuff. Because like obviously when you're on the plane, like you sleep weird.
That's different. That's different. I can understand that.
So yeah, she wore it on the plane. And by the way, I just want to say she loved it.
I mean, it's like a really nice neck pillow.
It's very comfortable.
I feel like the plane is the only acceptable place to wear that.
Nah, man, I ordered some because I'm stoked. It's going to game changer. It's going to be a game changer for us.
I don't think I could, with a straight face, tell someone to wear that.
Again, I would preface, hey, you're going to look stupid, but don't shoot this down right away.
This is coming from the person who took their eye patch off right after the doctor told them to wear an eye patch.
Okay, in your defense, though, best evidence says in that injury, eye patch wasn't a good.
Honestly,
call.
It'd be really.
But I still gave you a hard time about it because those were doctor's orders.
So anyway, that is really cool that Becca does this.
I know, that is neat.
Also, I'd like to say, I asked about hours, so we do have like some different settings and what their different hours are. So we'll kind of do some comparing.
Ooh.
And then we can compare to like what our schedules are right now, because I would say that our schedules right now are hard to beat. Yours and mine.
Yes, agreed.
Okay, so this next one is anonymous. Why don't you read this one?
I'm clinical staff in a pediatric sports medicine office. There's another athletic trainer with me, and we basically run the clinic. We bring patients back, get a history, run through an eval, present to the physician, and then run through the D part. We also get insurance authorizations, schedule MRIs, fit braces, show some patients exercises, and communicate with our outreach athletic trainers. I feel like I was prepared with my knowledge to take a history, do an eval, and fit braces. I transferred to this department from the outreach department in the same hospital. It took some time to learn the EMR stuff, the different information the physician wanted in the history, and insurance stuff. I work Monday through Friday, 7 to 3:30, 4-ish, no nights or weekends, way more consistent, no traveling, and I'm hourly. So if I go over 40 hours a week, I'm paid for it.
That is a flex right there.
That's a major flex. Also, by the way, don't sleep on the whole insurance authorizations. I had to try and do that one time, and I had no idea what I was doing, and it sounded terrible, and I didn't like it. It was a nope rope. I wasn't about it.
I know. I feel like sometimes people push for that, and I'm like, I'm okay.
Yep, I'm good on that part.
I'm okay.
But hey, getting paid overtime, if you go over your 40 hours, that's kind of nice.
Dude, that is so nice.
And I'm sure also the benefit of holidays.
Oh, yeah.
I'm sure.
I don't really mind working holidays that much. Like, actually, I don't mind working holidays if I know I'm going to work the holiday, except for, like Thanksgiving or Christmas.
Like the major ones.
I mean, I think just those two.
Fair.
Yeah.
That's fair. I think everyone kind of agrees with that.
I mean, I do like to take half days on those days.
Yes.
But it's okay if I have to go in, as long as I know ahead of time.
Yeah. Well, it does kind of make for a chill day sometimes.
Right.
Yeah.
I mean, it does suck when everyone else is off, but...
Yes.
You want to move into the military?
Yes, let's do it.
So this is really cool, actually. This one from Michaelyn S. We've been talking about this before. And this program is just like really cool. She said, prevention is one of my main focuses of the program for my pilots. So she works with pilots.
Nice.
Isn't that dope? The program is called Optimizing the Human's Weapon System. It is very non-traditional. I take care of A-10 Air National Guard pilots.
Nice.
My favorite part of the job is seeing them understanding their bodies better. They have poor body awareness. And then once they have a better grasp on that, they start to see their pain decrease and the quality of life improve. Hearing people say, I enjoy flying again, I don't have to pound ibuprofen all day, I sleep better, you're keeping me in the jet, etc. That's my favorite part.
Nice. You know, one interesting thing about like the military setting. From what I've heard people talk about it as, it seems like the military in general is trying to move towards like an athletic model.
Mm-hmm.
And like if you look at their job descriptions, a lot of times they're looking for people who have experience in collegiate athletics. So I thought that was very interesting that that's what they're trying to make like a traditional kind of model out of it.
Right.
I thought that was very interesting. And also I heard since you work for the military, like your license is like you can almost do anything.
For real?
Yes. Like I know some ATs, because of you're working for the United States military, that you can like dry needle and there's no problem. Like I know for some states that's not a big deal, but in California that's a big deal. Your scope of practice gets much bigger.
Well, they kind of have big demands.
A little bit.
We have another. I actually got just 2 military ones.
Okay.
So you want to read the next one?
Yes, this one's by Anonymous. Working with the military population is very rewarding and very humbling. There are a couple different ways of working as an AT. One, more clinically based, doing evals, rehab, working with post-op patients, etc. 2, combination between clinical side and field coverage, covering PT, fitness tests, going on rucks, and other training events / operations, including range day. The rucks range from 5K to 15K, carrying a pack at least 50 pounds while wearing protective gear. We cover not only for injury management, but also to get a better understanding of the physical demands of the units we work with. ATs also provide injury prevention, mobility, and nutritional classes on occasion. Typical schedule is Monday through Friday, 0800 to 1600. When covering in the field, typical start time is 0500. That is early. Very early.
Yeah.
But the typical schedule,
8 to 4?
8 to 4, that's not bad.
I figured like those 2 together would give us a pretty good understanding of the beginnings of military.
Yeah.
I feel like that one is the one that I'm most disconnected from. Like, I feel like I don't personally know any. I don't think I know any ATs.
Well, I think too, it kind of comes from the area that we're at. Like, we don't have like a really big military base like super close to us. So it's kind of hard to like see other ATs there. But like in San Diego, like that was kind of a big deal because you have the naval base, you have the Marine base out there. So I think it kind of depends on the region too.
Yeah. But I feel like I know someone who is trying to go to the military and they were looking for someone with like D1 athletics background. Yeah.
Yeah. And they've had a lot of job postings lately. Mm-hmm. Yeah, I've noticed that.
Okay, so now we're going to move into performing arts, which you got to cap me because I could probably talk about this all day. I know I've worked and still work at a well-known theme park.
Yes.
That we're going to talk about. Not too much. I can't talk about too much. But also I've worked with a cruise line.
Yes.
Professional dance company. There was one more performing arts thing that I was remembering, but I can't remember it right now, but I feel like it's going to come up.
I can't remember.
That's okay. But this one is actually about NBA dancers and collegiate dancers.
Oh, okay.
Yeah.
Nice.
So this one's from Calvin O. He said, "Hi all, I wouldn't mind sharing my story on how I ended up basically solely working with performing arts so far." And he also has a theater background, I think.
Okay.
I moved to Southern California to work with performers at a well-known theme park, but before that, I was looking into performing arts schools in New Jersey and New York, and Performing Arts College New York popped up as one of them. On my first day at the theme park, I was recommended by a coworker to interview for a Performing Arts College LA, so the same college. There's like an LA one and a New York one.
Oh, interesting. Cool.
The Performing Arts College has its fulfillments and challenges as well. Since it's my full-time job, I get to follow up with the students a lot more frequently. I've noticed that most students, especially those that are dancers, are much more aware of their body and space. I think a large challenge that I've noticed from several performing arts schools are the several factors of pressure they have to endure from their instructors, family, and themselves. I think that leads most artists to pushing themselves through discomfort to get the job done, which sometimes goes against what we'd prefer as healthcare professionals. But at the same time, you have to understand that since that seems to be the nature of the sport that has been instilled from years and years of constant pushing through with the dance, the gig, the audition with a smile on your face, I will say my favorite parts about working in the performing arts in general is that my overall goal is to allow them to do what they love. I know it's not my job to change the choreography, so I come in with the mindset of how they can get the job done in the most efficient way without sacrificing the pictures/movement/arts they envision and create. Which actually I do want to say, it's really interesting how like working with dancers, all of unless they're doing like improv and stuff, like pretty much they have planned movements.
Yeah.
And that's something that's unique that you don't have necessarily in sport.
Yeah.
I mean, you know they're going to cut at some point, and you know they're going to sprint at one point, but they're going to sprint exactly at 3 minutes and 30 seconds of this like one, and they're going to do it over and over and over again. And
also I feel like coaches it's a little bit easier to change the game plan with them because as long as the job gets done like that, it doesn't have to look any certain way. As long as the result is done for like traditional sports, I feel like that makes it okay.
Right. They can't be wincing on stage.
Exactly.
So actually, before I finished Calvin's story, I did have a collegiate dancer who injured her ankle in she was like on a trampoline.
I remember this.
Not a dance trampoline, like just like 2 a.m. She was on a trampoline and thought it would be fun. And she injured her ankle so bad. I don't remember what it was, but she wasn't able to walk. And so obviously she couldn't perform, but she actually, luckily, was the choreographer.
Oh, nice.
For the performance that she was in.
Nice. And
so we were able to work with her on like quote unquote changing the choreography so she could still be in it.
Oh, that's cool.
And so we actually put her on a rolling stool.
Nice.
And so she was able to do like arm movements and leg movements and also like incorporate like the Pilates that we did, because like Pilates is a lot of like stable core and moving like arms and legs. So like she was sitting on the stool, like rolling around, like, you know, hamstring rehab, like pulling yourself on the stool. She did a lot of that to prep, which I thought was cool. Like really cool and unique because like she was still able to perform.
Yeah, that is pretty cool.
Yeah. Also,
doesn't it kind of depend on the type of dance style you're doing? Because, right, isn't like contemporary very like, you can interpret it different ways? Like, couldn't contemporary be like just eating cereal?
I think you're thinking more modern, but
that's what I was thinking. Modern.
Contemporary, basically, you could put that in front of like any term, any dance style. I feel like contemporary is not really its own thing.
Oh, okay. So I meant modern.
Yeah.
Yes. Right. So it could also depend on that.
Right. Exactly. Actually, it's funny because I think she was doing a modern piece.
Hey, see? So
right.
It worked. That's the expanse of my dance knowledge.
You treated my dance injuries.
I did. I did my very best.
A year and a half after, this is still Kevin's story. A year and a half afterwards, I was recommended a position to the Performing Arts College, New York, and an opportunity to help with the Brooklyn Nets dancers, which is an NBA dance team.
Nice.
The Brooklyn Nets is great. It's very professional, but also easygoing. It's the closest thing to game prep / on-field care that I've done for dancers, maybe outside of the parades at the theme park. I work for them per diem, so injury intervention is usually either manual therapy or through movement, and it's usually day of. Intense choreography are usually done on heels, and the breakers on the hype team have their own set of challenges with the stunts and acrobatics.
Oh, man.
So definitely have a workload to supervise / assist with. Funny thing is, and I love this part, the person who got me the New York opportunities was an AT who met me at an ATSNJ conference, overhearing me speaking to my classmates in grad school about potentially getting an internship with the Harkness Center in New York, a branch of NYU Langone Hospital that solely helps performing artists.
Oh, that's crazy.
So
you never know.
Network.
You never know. And you never know who's listening.
Networking is how I got started with the professional dance company that I'm starting to work with. Networking is how I got the job that got me into community college athletics. So networking is, I stress, at least to my students, like I told my student, I don't know if my student's listening to this, but my current student, he just went to
CATA?
Yeah, to the California Athletic Trainers Association. And I told him, I said, you better come back, because I think it was like he was up there 3 days or something.
Yeah.
I was like, you need to come back and tell me 3 names of new people that you met that you networked with. Like, that's 1 per day.
Yeah.
I need you to meet 1 person per day that you didn't know outside of your bubble, and I need you to come back and tell me their names.
Nice. That's a good idea.
Yeah, as simple as that. Like, start with a goal like that. Networking is so important. I stress it so much.
Yeah, no, it is. It's a big deal. People don't realize it until like opportunities like
things
that.
like that. Yeah. So also Calvin was talking about how like dancers and artists like push through discomfort and everything.
Yeah.
And I think that's actually really interesting that he brought this up, because I feel like that's also shaped my clinical philosophy.
Yeah.
Because I always try to modify as much as I can before taking someone out. Like, it takes a lot for me to take someone out. And I think it's because in my sport, in my background, that's what you did, is you just push through.
Yeah.
You would just push through safely.
Of course. Yeah, that's definitely something I've had to adjust for the team sport people, because team sports are definitely different than individual sports.
And I think if you're going to start working with performing artists, like, you have to know that. And a lot of times, because if you don't perform, then you get taken out. You
lose that spot.
If you don't perform, you lose your paycheck. And so, like, that mentality, I think if you're going to start working with performing arts, that's huge. Like, you have to do everything before you take someone out.
Of course.
Like, everything. It would mean so much.
Oh, yeah, big time.
And I mean, I'm sure, like, athletic trainers try to do that anyway, but, like, emphasis on that.
Before you get super frustrated and are beating your head against a wall.
Right.
Come from that understanding.
Right. This next one's about a ballet company.
Ooh, nice.
You want to read it?
You used to dabble a little bit in ballet.
Mm-hmm. Go for it.
All right, this one's by Kylie D. So I'm contracted through a hospital system to work with a ballet company. It's a smaller contract, not full-time or part-time, but we, me and another AT, go out there on rotating days to provide evaluations and treatments as necessary. The company turned a dressing room into our clinic space, and we put a treatment table, splint bag, cupping sets, all wound and taping needs, etc. We send out our weekly times, and the performers select the time that works best for them. We have a team physician we refer to. Their health insurance is partnered with our health system too, I believe. And we coordinate back and forth to provide best care possible. We stay pretty consistent 1:30 to 3:30 time frame generally, but the timing of treatments is honestly so rough during the day, especially on days they don't all have a break at the same time. We also have an area backstage for performances. We show up about an hour and a half before performance, do some treatments as needed, watch backstage, and just stay alert for anything anyone needs. It's a dream.
That just made me smile so big.
Then I supplement income with contract work for more experience as well, since it isn't a full-time or part-time job.
That's also something that's really tough, is in the performing arts setting. I feel like right now, I feel like most of the time it's like contract work.
Yeah.
The only time that you're going to see full-times are like at a college.
Yeah.
Or
one day though.
Some shows like have them, but
yeah. One day though, it'll happen.
Yeah. It's just hard because like money in performing arts is already like,
of course,
stretched.
Oh yeah, big time. Until you make it to the big time.
What, like?
I was hoping you'd fill that in for me. What the big time is.
Broadway.
There we go. See, Broadway.
So this also kind of reminds me of, I don't think I've talked about working with the cruise ship performers yet, like on our podcast.
I think you mentioned it one time, but not working with them.
So through the theme park company, we have, I don't know how to say this without like
giving it away.
Right. We have cruise ships through the company, And basically, I don't get to go on the cruise like for a week or whatever, which is fine. I mean, I don't really want to go, but
Well, especially nowadays.
right. But what happens is like when they dock, because we have performers on the cruise ships, they dock, everyone gets let off, and then I go in for the day, like a 7 to 3:30 shift.
Yeah.
And I'll go in and I'll check in, and I have like, I think I'm in one of the dressing rooms, and
Okay.
I have a little sheet, and the performers can sign up for like 20-30 minute slots throughout the day, and they just know when I'm going to be aboard after they dock. And then basically it's such a unique position because they have to keep performing through whatever they're dealing with,
Of course.
until they dock.
Yeah, 'cause
like they
there's
don't
no
have
help.
anyone there.
Yeah.
And even like if they did, it's not like they can refer out. It's not like they could.
Yeah.
There's only so much they could do. So, I see things that have happened like a week ago, or
Yeah.
happened like 2 weeks ago, or like however long the cruise is, and or I'll see things that are like, oh, I need to get this checked out before I go on my next
Yeah.
ship.
The next voyage.
Right. And the best part of the cruise ship is they feed me
I was
all
waiting
you
for
can
that.
eat.
Yep.
So
You
then
get-
like I have the 20-minute appointments, whatever, 30 minutes, whatever they are, I don't remember. And then I get like an hour to just dine, cruise ship, whatever I
and
want.
that's one of the best parts about cruises.
So I eat like
the food.
I have like crab and I try like 5 different desserts. They have a soft serve,
Oh, yum.
and
That
it's all
sounds
it's
awesome.
all there.
That sounds awesome.
It's so nice. It just takes me like 2 hours to drive there, but all right, we have one more performing arts, and then I think we should move on.
All right. This one's by Mariah S.
And this one also covers 2 parts of performing arts.
Oh, okay. In drum corps, so I think we're talking about drum corps.
And then we'll also get gymnastics, yeah.
In drum corps, the hours were pretty much 24/7 with breaks throughout the day. Drum corps is a seasonal position from June to August. On a typical day, we would wake up around 5:30 a.m. and have a staff meeting before the corps woke up. We would go over plans for the day, talk to coaches about injured athletes, and go through safety precautions such as weather and EMS routes. These things changed every 3 days with our location. We would have rehab available during meal times and would work with harder cases in between those hours. When not doing rehab, we would take turns being on break or being outside during rehearsals. During stadium rehearsal days, we would all be out during rehearsal no matter what because it is more intense rehearsal, and we are prepping for a show the next day. Dinner was around 6 p.m., and that's when the day slows down for the ATs and we get to eat and talk and play games with the corps, or shower, or take a break before bed. In drum corps, you are traveling with the corps, so you're always on call. If someone is throwing up in the middle of the night, you're the one who gets woken up at 3 a.m. Also, lots of times we would travel to our next location at night and get to a school around 4 a.m. So then we would have to unload and set up the AT corner. Interesting. For the morning. It's a very intense setting, but I personally loved it. The reason I got into drum corps is actually because I had an internship set up for the summer between my junior and senior year that fell through. And this one was my backup that I didn't really want.
Isn't that funny how that works?
It's definitely funny how that works. You just never know what's going to happen.
I mean, like, I was really against baseball before the spring.
And now look
like,
at you.
really against baseball.
And now look at you. You're all in.
Kind of. I'm still afraid of facial fractures. Let's get that straight.
I had connections from my high school marching band director who marched drum corps when he was younger. I am so glad I ended up with drum corps, though, because I love the setting so much. Working with those performance athletes sparked my interest in gymnastics, where I work now. Ooh, gymnastics is interesting.
I would love to work with gymnastics.
My gymnastics hours are much more straightforward. Practice runs Monday through Thursday, 3 to 6:30. I have the liberty to clock in anytime earlier in the day to do paperwork, write workouts, write rehab plans, or contact athletes, parents, or doctors. Then I show up at the gym around 2:30. if I have athletes that would like treatment before practice, or if I have to set up rehab stations to teach a group. I sometimes get 40 hours per week, and sometimes, not depending on the season we're in.
So also, if you remember, Mariah is the one who shared, I don't remember, probably our ATR episode.
Okay.
She shared about the traveling ATR.
Oh, yeah, I remember that.
And if you guys will listen to that, or if you didn't listen to it, we have, I think we have pictures in our Facebook group, or just reach out to us because we have our Instagram.
No, of course.
I'm pretty sure we put them up in the Facebook group because
Yes,
I remember asking her for them.
Yeah, no, I remember setting that up. Nice, that's cool. Man,
I know.
See, drum corps, the professional and D1 athletic trainers for sure know that 24/7 feeling. For sure. Share.
Well, you did this past 4 days.
Oh, yeah, I did. At the NAI level, I traveled. Which, I mean, there are schools that do that, but I haven't had to do it in a while, so it was...
Randy went from traveling... He literally, at the D1, he was traveling like 4 days out of the week.
Yep.
And then at a different D1, he was traveling 2 or 3 days out of the week. And then now he was traveling like no days out of the week. And so we were very surprised when all of a sudden he had to travel 3 days this week.
Yep. It was a good trip. It was a good trip. I made the D1 experience for the kiddos.
Actually, we should give a flex on our hours right now. You should tell your hours. Well, you have better hours than I do.
Oh man, my hours are pretty good. So I'm more than likely I'm starting at 7 a.m. and then I'm usually in the clinic with practice coverage and stuff until maybe 1 or 2, and then I'll do my admin time at home, maybe for like another hour or 2. So I usually am done with my day around 3 or 4.
Which is so nice.
So nice because I'm doing admin stuff at home.
Yeah,
that's pretty
really
clutch.
Nice.
So I'm at home by like 1 or 2. Oh, so great.
So he like eats lunch at home.
Oh, it's so great.
And then I'm at the community college, and usually I'm sitting around 10 to 5.
Yes.
Probably. I do have an hour drive there and back, which sucks really bad, but that's going to change.
It will. And also, it's funny because I am not an early bird for the morning. And I have the earlier schedule.
Yeah.
It's brutal.
Randy also usually Randy's hourly, so he usually gets holidays off. He gets overtime.
Yep.
I would typically, but my contract's a little bit different. So at this community college, I don't. But I think we're trying to change that too. Hopefully, crossing your fingers.
Yep. Fingers crossed.
But I would say typically at the community college, it's hourly. You get overtime if you go over 40 hours.
Yeah.
Which is clutch. They pay really well, like starting...
At least in California.
In California, because there's a lot of funding.
Yeah, a lot of funding.
And I don't travel. Unless it's postseason.
That's nice. I mean, traveling's fun. Unless you do it all the time. Then it just kind of gets old. Then it just becomes part of the job. You don't think about it.
Right. Okay, we have 1.5 more settings, kind of. Left.
Oh, okay. Nice.
We have some really passionate people about the industrial setting.
I'm telling you, the industrial setting has gotten some pretty good followers. Some people have gotten amped about it.
Yeah. I mean, I feel like it's really growing. It's almost like not an emerging setting.
Oh, big time. There's a lot of people that really enjoy it.
Right. Like everyone who I know who's transferred to industrial loves it.
And also it's really cool to see that these companies actually recognize how valuable having an athletic trainer is.
I mean, even at our theme park, we have an entertainment side and we have an operations side. And in the operations side, I don't work on that side, so I don't really know like the day-to-day, but I do know that they all pretty much enjoy.
Nice. That's cool.
Like at least who they work with.
Yeah, that's really good. That's important.
Right. I mean, also working in a theme park's kind of fun.
Yeah, that's true.
Okay, we have first a program manager in an industrial setting.
Ooh, all right.
So Andrea H said, I really enjoy this setting. My position feels more like a clinic than the traditional setting. I spend a few hours each day doing rehab on the workers at this factory. We also manage the fitness center, so we do a lot of fitness and nutrition questions throughout the day. When we don't have patients, we go out on the floor and do ergonomic assessments of the workers for injury prevention. It's a tire factory that mixes its own rubber and follows the process all the way to distribution. A lot of different jobs and all sorts of people out here.
Oh, yeah. And it sounds like a lot of repetitive movements.
Right. And actually, that's something that I get to do at the theme park is we get to do body motion assessments. So if someone is having pain, or actually, no, not pain because of OSHA. If someone's having discomfort, then I can go out and watch their movements.
Yeah.
Which usually involves me like watching a show or watching them perform or something, and then I get to like look at are they doing excessive valgus? Are they like could they benefit from some core or hip strength or stability and different like whatever. And so like we get to do those things and then we get to apply them as quote unquote rehab. We don't do rehab, but like that's what as injury prevention.
Of course.
And then also we deal with like the different harnesses. We get to figure out like where it should be sitting on their back, and maybe like especially like in parades when people have really heavy floats, or if they have like really heavy costumes, like the harnesses sit differently, and sometimes the harness can't sit in a certain place because it can't show in the costume. And so we have to kind of play around with like we'll have a costume consult with a safety manager and us and actual managers like for the costumes, and then like costumers and dressers, and then we all kind of meet and try to like troubleshoot how that costume can affect this person, and to see if it's a costume problem or if it's a strength problem or if it's an endurance problem, and like what needs to be fixed.
So communicating with the coaches.
Exactly. And then also reading about ergonomic assessments just remind me, because this is just a really fun one-off thing that I got to do, was after all the social distancing things need to be like taken down and everything, we had a day, actually a night, because after the theme park was closed, that all of the managers came out and were pulling up all the stickers that said social distancing that had been there for months. And so my job was to go out there and make sure that they weren't hurting themselves doing this. And so I was giving them ergonomic like cues.
Now, I heard these bad boys were pretty tough to get up though.
Yes, exactly. They were there for
months.
Probably over a year, I think.
Yeah, that was back when we thought COVID was over.
Right. And so
LOL.
like there were so many people who just like bend over and try to pick it up like without bending their knees. And so I would have to go tell them like, oh, like don't hurt yourself. You got to do this. But
without being that guy like at the gym and
right.
Oh, you're doing this wrong.
I know. I tried to give more like positives.
Yes, that's good.
But they were all very appreciative.
And I heard it was actually a fun event. Like they made an event.
It was super fun. They were playing music. I got free burgers from
Yes, you
the
did.
Habit.
I remember that.
Mm-hmm. And I got to do a big warm up with all of them.
That's cool.
Yeah,
that's really fun.
And I got to be in the park after hours, which is pretty cool.
Whatever. That is pretty cool.
Oh, okay. This one I'm really, really excited about. I actually didn't read it because Erin's sent in some stories before.
Okay.
And she's really passionate about the industrial setting, and she I asked her, I was just like straight out, can you tell us about the industrial setting? And she just like went over and above. I'm so excited about this.
So this one's by Erin G. Okay. So in the industrial setting, it really seems intimidating at first because we as athletic trainers have to operate under what is called OSHA first aid. And while first aid to us in the traditional seems like no big deal, OSHA first aid comes with a bit more rules.
Like a lot more rules.
An example of this would be if someone has a work-related sprain/strain injury, we can't prescribe new exercises or stretches for them to do. We can evaluate the ankle, educate them on involved tissues, the anatomy of the ankle, the phases of healing, and self-care. Self-care is my cheat verbiage for ankle pumps, alphabet, heel raises, etc. Again, I can't technically prescribe these exercises, especially if they are new to the person. So I need to either ask if they have done or seen these exercises before, and then recommend they continue performing these exercises or modify the existing exercises the patient has already been performing.
That is 100% what I do.
Yes, and my favorite is the eye roll emoji. That definitely sounds like it. She continues with, the reason we cannot prescribe new exercising is because OSHA sees that as physical therapy. And once physical therapy is involved with a work-related case, it is flagged as a recordable injury. And that is usually the whole reason organizations/companies have ATs on site, to prevent and reduce their recordable injuries.
So, like, we don't want it to get to that point.
Of course.
Anytime, like, this is the same thing for the theme park. So, because they're employees,
Yes.
Anytime that we think that it's going to get to that point, we have to document it. And, we have to document everything. But we have to document it in the specific, like, healthcare
Of course.
EMS system. And then we have to be careful about what we do, because if it does go on to become a recordable injury, then they're going to see, they can go to like the health center where they see a physician, they can get prescribed PT. And then if they want, they can send them back to us with an AT work order. But in order to, and then we can do like quote unquote rehab.
Of course.
But they have to see, if that's the case, they have to see the physician first.
Okay. The other thing OSHA allows under first aid is Band-Aids, ice/cold, massage. Yes, they use that term, but luckily for ATs, we obviously know a variety of soft tissue mobilization techniques that we can use, which satisfies OSHA, the first aid massage term. In my experience, I have only been in charge of managing and preventing musculoskeletal injuries and discomfort. There has always been another company on site that provides the traditional first aid. We think of like abrasions/scrapes/lacerations, etc. Usually staffed by nurses or EMTs, which is nice in some aspects, but in others can be difficult, because usually these companies/staff don't know how to properly test musculoskeletal conditions and or manage them. Not in all cases, of course, but in my experience, this has been the case. There are some AT industrial companies where the athletic trainers are also doing wound care alongside musculoskeletal injury management. It really just depends on the injury prevention company itself and the company that has brought the injury prevention company on site. So there are the injury prevention companies that are brought on site as contractors/vendors to provide this service. And then there are some companies that hire ATs directly. So they are direct employees, traditional ATs. This is much like how hospital systems hire ATs to provide outreach to schools versus school districts direct hiring ATs. The other thing ATs can do on site are visiting workstations and job departments on the floor to visit with managers, supervisors, team leads, and employees/associates directly if there are any needs or issues that we can help with. This is very similar to how ATs go out to practice to check in with coaches and athletes alike. We also operate pretty closely with the company's safety team, much like traditional ATs working with athletic directors. We can also perform prophylactic taping. We can put together job department-specific pre-shift warm-ups, bracing, nutrition coaching, and all that good stuff. I find that a lot of my time is spent educating, because you are at times dealing with people trying to navigate the healthcare system, which is definitely not easy.
Right.
She continues with, there are also a lot of people who didn't really play sports growing up, or when they did, they didn't have an AT. So you are also exposing them to sports medicine and how it can help them not only at work, but also at home. How about retirement, people? Question mark. So many people just try to muscle their way through their day and get home. But you have to remind them that there is more to their lives than just work. So how can we get them feeling better so that they can get on the floor and play with their grandkids over the weekend and not have to pay for it the next week at work? Or how can we help them get back to golfing with their friends?
See, it's all putting into perspective.
Absolutely.
Because that is their sport.
Oh, 100%. It's all about that quality of life. Right. We're not just looking at the work. We're looking at the person in general.
Right.
I helped someone with a fibular fracture get back to hiking and snowboarding. It was a non-work related incident, thank goodness, so in those cases I can operate under my State Practice Act uninhibited. But if you think about it, he was still affected by his injury at work because he had to wear steel-toed shoes, walk around, and stand on concrete for 10 to 12 hours per day.
Shoot.
Holy smokes. It really is very similar to the traditional AT settings. You just have different sports that you have to learn the ins and outs of, and the athletes all have different wants and needs you have to try to meet. I'm so sorry this was so long. I sometimes forget how much I love this population and setting. It wears you down just like the traditional setting, but this allowed me to be reminded of how much an impact I get to have on my industrial athletes' lives. Thank you. Also, I'm sure I left out a ton, so let me know if you need any details, like I don't even think I got into body mechanics coaching or working with engineering teams to change workstations to better reduce injury risk and to suit the employee better.
There's so much.
I bet. And it also sounds very traditional-like, just different.
Just different. I feel like this is so similar to what I do with the performing arts.
From how you described it, like that is like exactly what you do.
And I think something, I mean, like she was saying, and also something that's we're gonna go over in one of the next stories is like these people are not really exposed to athletic trainers, and so they are so appreciative, like because it's not something they take for granted.
Yes, absolutely.
And they don't even know it exists.
Yeah.
And then all of a sudden you help them.
Oh, big time.
Which is also just like
super rewarding.
It's so nice.
Super rewarding.
Right. This also reminds me of in performing arts, we also have theater at the theme park. And so working with that, you have to know, like she was saying, like who, like talking to the coaches, like quote unquote.
Yeah, for sure.
In the theater, we have contingency plans. So like if we need to take female 1F out, then who, like, does it change the show? Can we put an understudy in or like someone else who trained in that role? Or do we have to modify to take certain scenes out or modify to put people in different formations or like whatever? But you have to know who to talk to. So like, do I talk to the stage manager, or do I have to talk to the assistant stage manager, or do I have to talk to the choreographer, or like who needs to know that this person can't perform?
Oh, that's
or like if something happens mid-show, like how are they going to tell everyone, oh, we're changing to this contingency plan?
Yeah.
Like no 8M contingency.
Yeah. That's interesting.
And so like in any of these, it's almost like talking to your offensive coordinator and saying like, oh, your running back's going to be out.
Yeah, for sure.
You need to find another one. Or maybe don't run a run play.
Yes.
Okay, you want to move on to business owner and PT clinic?
Yes.
Okay. So I'm actually surprised we didn't get more of this business owner. Like I feel like we have a lot of people who have shared in the past about private practice.
And also we had a pretty cool interview with Mike Stella.
Right. So that's recent. First of the year. I think.
So if you haven't checked that one out yet, I would encourage you to do so. It was a good talk.
Really, really good. So this one's Jenn T. She said, I am a business owner. I have time to take care of my clients in the way that we both agree on. There's no line at the door waiting to get out to practice or insurance telling me what they consider to be treatment. I can utilize my full skill set and schedule clients in a way that fits both theirs and my schedule. At the end of the day, it's the most gratifying job because it's on my own terms. I am responsible for my own success and my learning experiences.
You know, there is something about it to say that, hey, I'm the boss. Like, this is my my business. Like, that's pretty cool.
I know, and I think something that people, like, you really do have so much freedom, but you also have so much responsibility.
Oh, 100%.
And I think that I really commend people who put in so much effort to create their own private practice.
Big time.
Like, because you really have to find your clientele and find your niche.
Yeah.
Like, what are you good at? Hone in on that. And then
Well, also,
I don't want to say sell yourself, but like you got to sell your product.
Well, and also you have to be good at other things to make your business thrive. Like you have to be pretty good at social media or like marketing techniques because that's going to draw attention and that's going to get people in the door.
I was messaging someone and they were like, lots of Googling.
Yeah, that sounds about right.
Trial and error.
Yeah, that's good though.
Right.
That's good.
Okay, last one.
Yes. This one's by Andrea C. I just started at a small PT clinic, not a corporate or a chain. The woman who owns it is currently married to an AT, so when I walked in with my resume looking for a part-time reception/tech position, her eyes lit up. I'll get to do training appointments with patients that are discharged, but are maybe not ready for the gym yet, wellness checks, and sessions for people who just need maintenance. And we are looking into having me run clinics on Saturdays for balance/fall prevention for our older clients. I can't bill here, but they'll work up a self-pay option for me, so I'm getting to use my athletic training skills still. I'll eventually be sent out to events as well on the weekends for traditional AT stuff and injury screens. Besides verbal appreciation almost once a week, on Valentine's Day, I went home with a new cheese knife and a full charcuterie board. That's nice.
Mm-hmm.
I'm home by 6 to put my kids to bed, and I've been able to take time off to get her to doctor's appointments last minute, no questions, no guilt. That's nice. That's a supportive boss.
Right. And I don't want to discount, like, you can find those good hours in the traditional setting. Like
Absolutely.
Both Randy and I do. Like, okay, my fall is going to be nuts. I know that. But my trade-off is the spring and summer is a lot lighter.
Super light.
Like super light.
Super light.
So, I mean, even I'm still trying to work 5 days a week. You work 5 days a week.
Yeah.
And so like in the traditional setting, you can find that. But it is so much more likely in the non-traditional setting.
Yes, absolutely.
And I think that's a huge major point that goes for it.
Oh, absolutely, definitely.
Also, like, I just that appreciation that she's getting and all other ATs.
A charcuterie board.
Right. That's just awesome.
That's so cool. Hey, no one should knock charcuterie boards because those can get expensive, by the way.
Yeah.
Like if you get a real fancy one, just saying. There's a lot of effort that goes into those. I'm just saying.
Grown up lunchable.
Yes, welcome to snack time on AT Corner, where we talk about charcuterie boards.
You got anything else you want to
Nope.
kind of wrap it up?
Yeah, let's do this.
So we have a Facebook group if you guys are new. It's facebook.com/group/AT Corner podcast. You can network, like I was telling you before. You can network with other athletic trainers. You can share your stories. If like this brought up a story, you're like, oh, hey, that made me remember this. Head over to our Facebook group. You can post in there. You can answer our question of the week. The only thing is it's an automatic approval. So make sure you answer the questions. Like it's like, where did you hear about our podcast? And then you'll automatically be approved. If you didn't get a chance to submit for this episode, we do have other upcoming story episodes, and we are going to be talking about secondary school setting, hopefully soon.
Yes.
So make sure you keep an eye out on our Instagram where we post looking for those stories, or you can just send them our way. And then we do every other episode as education or stories. So this one is a story episode. Upcoming is education, and I think it's going to be a CEU episode.
It will be a CEU episode, and for this one, it will be released on Thursday.
So keep an eye out for that. Remember that the 5 latest CEU episodes are free. So because this one's coming out next Thursday, that means that the 6th latest one is going to not be free anymore. So if you want to get that while it's still free, make sure you check that out. You can just go to our website, which is down in the show notes below. Anything that we're talking about is down in the show notes below. And then I just like to do this call because we haven't done it in a while, is please share this with other athletic trainers. We have gotten to meet so many of you guys. Yes. And we're just really so thankful that we get so many stories. And I think that we can probably get so many more the more you share with other athletic trainers.
Oh, big time.
Also, it's so easy now to rate us on not only Apple Podcasts, but also on Spotify.
Yes.
And
right.
It's just like a one tap. Like, pick however many stars you want.
And hopefully it's 5. Hopefully 5 stars.
And then I think that's it. If you want to leave a review, you totally can. We'll read it on the show.
We get super jazzed. And yes, we will read it on the show.
We get super jazzed. Like stompy feet and like
wiggles.
Wiggle shoulders.
A lot of wiggling. Oh, yeah.
All right. I think that's all.
Thank you for helping us showcase athletic training behind the tape. Bye.